And you're saying that if they just don't tell them they have insurance at all, they can just bypass it and pay cash.
Yeah. I've seen that recently on like one of these doctor Facebook groups that I'm on, where this family said, you know what, we just decided we're going to tell them we're paying cash at the doctor's office. And they actually, if you are not paying by credit card, if you actually pay by cash, you're avoiding using their billing system. And it was a true story. They were like, they were given a different price because they were paying cash, even versus paying credit card. And I was going to tell the story about, I have a nose spray that's $300 prescription for a nose spray. And my insurance won't cover it, but I can pay $40 for it if I pay out of pocket cash. My price is $40.
Okay, we're back again, everybody. We want to first of all thank you guys. We're back again now. This is the business of healthcare with Healthcare Henry. This is one that we've interviewed them before. If you've seen it and you loved it, we're happy that you're coming back again. Now, everyone knows about this, the Real Deal Doc. One is a doc, one is a nutritionist. That's the term for it?
Nutritionist trainer.
Okay, and when we talk to Dr. Dale and Mrs. Jennifer, we want to go through the business of this because it's very different on our side. When a lot of people are seeing healthcare, and a lot of you have been asking us a lot of questions about, well, how will these Medicaid cuts affect hospitals? And we know hospitals actually, for rural communities, run the entire community because of people that work there. A lot of them actually work at the hospital. So their restaurants, could they be closing? The gas stations, different convenience stores and things like that. So we want to give you guys the real piece of it. You guys have seen them. You've heard about them. We've talked about their program. But now let's actually get some real deal information from the Real Deal Docs. And first of all, thank you guys for coming back again. It's a pleasure.
Yeah, good to be here with you.
And I don't want to, because they know who you are now, right? And I think the other part of this is they understand where you all stand about being healthy, why you should be healthy. But the biggest questions that we're getting, and because you guys you're different in a sense that you're both, Dr. Dale, you're actually a clinician and a business owner. How does that work for you in your mind when you're looking at it from both sides and what's going on in America? What are you thinking? What should we be looking for? What's the future going to hold with all we've got going on right now?
By business owner, thankfully we're working together because she's doing a lot of that heavy lifting in the background. But again, it's definitely a partnership that's important because I bring my medical knowledge, she brings other expertise and knowledge, and kind of together. What we're trying to do is cut through with some level of clarity and honesty, and getting through whatever red tape that holds up other area or industry in the medical field, and really kind of get right through to the consumer, the user, the individual, the patient, the person, which is really kind of nice, and it's kind of refreshing because. Again, there are so many, often at times you find that there's so many barriers for that end user, again, that being, the person, the patient, the individual, difficulty with navigating where they need to go and who they need to get to see, to figure out how to solve their problems, their medical issues. And that in itself can be, a job and a half. So it's nice to try to bring that directly to a person and say, listen, it doesn't need to be that hard. We can do this a better way, a different way, in which we can get right down to the point, and let's talk about why you're here and you have a problem, and we want to work with you to help you solve that problem, as opposed to wasting so much time. Again, just trying to navigate what is otherwise a very cluttered system at times.
What do you mean fluttered system?
Cluttered system. Well, again, it's very hard these days, especially when people rely so heavily, on insurance. And the insurer goes, well, okay, you need to go see a doctor, but this doctor is a second tier with your insurer, but they're in the hospital they work in is within your network. So then you're doing the math here, and you're saying, like, so I would have to pay a higher copay to see this person, but then I wouldn't get a fee because their office is in this hospital network. And most people don't even understand what that means. So, I mean, the frustration before you even say, like, I need to talk to somebody about my high blood pressure. You're already getting frustrated by your insurer as far as where to go, who to go to, how to go to them, the who, what, when, where, why, how.
And then also I'll say when you go to them, it's like they're not necessarily giving you the adequate time that you need to make a full transformation for your health. They're not giving you specific recommendations of what to do when you go to the gym. It's like, you should go on a diet and exercise. It's like, well, what does that mean? Right. So that's where we fill the gap.
So there's this thing where you've got to you have to navigate, your journey to this arrival. And then sometimes you realize there's an arrival fallacy that you show up to the all-knowing doctor and hey, I'm talking about my colleagues and my people. I am a doctor, but further to our conversation in previous, there's a lot of red tape and there's constriction. There's time when you go to see a doctor that they may not necessarily be able to give you, what you need time-wise, because there's a lot of information that they need to get in and have a lot of questions that they need to ask. And a lot of times it's yes, no, and it's a very structured type of setup, right? And really, I might be getting a little long-winded here, but what is a doctor? A doctor is really a trusted friend who should really be endowing you with knowledge so that you can ultimately achieve your wellness goals, your health goals, right? And sometimes that requires medication and things like that. But a lot of handholding and explanation goes a long way. When people don't understand why they're doing things or how to do things or why and all that is not explained and the time isn't taken, it just becomes a very it just becomes a thing where people are just kind of just put on
lost.
Lost, and they're relying on their autopilot there, So just do as the instructions and go on your way. We'll see you.
Here's a pamphlet.
Yeah.
See you in 2 months.
Yeah.
So I guess then that how long have you been actually practicing?
So I have been an independent practitioner for nearly 7 years now, but including my training, it's been nearly a decade.
Nearly a decade. Okay. And one of the concerns that people kind of voice to me is the time in the doctor's office. And is that something that you've seen change since you've been a clinic, or is that it seems to be relatively new to me?
It hasn't changed. It's always been a rush. Okay. And there are a lot of good doctors out there that care, and they will go overtime with their patients. And it means maybe that last patient at the end of the day is going to run late and everyone is going to be behind. And I've seen doctors work that way, but they still manage to get in there, 17, 18, 20 encounters, right? They have to get those encounters because sometimes they only break even after 13 encounters, right? To keep the lights on.
So you're talking about an everyday practice, like a family medicine practice.
Family medicine, internal medicine, primary care, those two worlds, family medicine, internal medicine. You're talking about a doctor who's basically needs to be cranking out an encounter every 15 to 20 minutes, maybe a little bit longer if it's set up for an initial establishment of care. So there is an intake and a history and physical that needs to take place. But aside from that, the quality of care is almost assumed to be implicit on the end of the patient, and the doctor will and should meet that standard of care, but it may take place in a very shortened amount of time. Because at the end of the day, I remember working with a family med doc on a rotation during residency, outpatient, just so I could just see what takes place in that setting, specifically family, even though I'm an internist. And he said it's private practice, and my first 13, that keeps the light on and the medical staff paid for and everything else. After that, that's what I earn.
So how long is one? How long is one actual?
It may be 5 minutes if it's just follow up to review some labs or change some medications, but typically it's no more than 15 minutes. I mean, the doctor's gotta get to the next room. There are people that are already been placed into rooms, and the minute that you miss the beat on the first two, everything else gets backed up. And some doctors don't mind, and some patients don't mind. They'll say, "Hey, I love my doctor. I want to wait because I feel they give me that extra 5 minutes to make it 20 minutes, and that makes me feel comfortable. And I think that's great. You know what I mean? As long as that's kind of the unspoken truth. But a lot of times, more often than not, this can't be, because it's just not an efficient model based on the compensation that doctors are set up with, which is volume versus actual time spent with the patient, right? So the more encounters, the more heads that you can count and get through in a day, the more the compensation will be.
So essentially, medicine is a numbers game.
It is, but unfortunately, I don't blame doctors for this, with the exception of maybe concierge private practice, where they name their number and people are like, hey, my doctor gives me an hour and I'm willing to pay for it, and I can pay for it. But that's not the case for mostly everybody. Fair enough. But this is a box that insurance companies and payers have put doctors into while we were busy focused on the science and the medicine and the art of all of it, and we had our heads down. These guys were figuring out what we're worth based on what we do and how we do it and all that. And
squeezing more juice out of you guys.
Basically, if you look at doctors' salaries, relatively speaking, the relative wage has been stagnant compared to other areas of industry. So it used to be that doctors were high on the food chain as far as reimbursement went 20, 30 years ago for professionals, right? But that's no longer the case. And doctors had to compensate by squeezing more in order to keep up, right? And not just necessarily a lifestyle, but to keep up with the cost of living, right? And also, let's face it, I mean, I was putting in time and energy. We were sacrificing, from an economic perspective in the household for many years while our friends were making money, investing money, and doing all these things. So many doctors feel, I would say, rightfully entitled to play catch up and earn a good living. But insurance companies have definitely put the squeeze on us. And now, even with, just segueing into the whole thing with Medicare fraud that has gone on recently, that was like last summer.
Right. You're right.
I mean, this is, who are they going to turn around to right this wrong? They're not going to go back to these insurance companies. Government's not going back to the insurance company and say, give us back our money. They're going to say, all right, docs, we're cutting your reimbursement by 2.8%.
I've been seeing that across the board. And even in Georgia, Illinois specifically, doctors have been essentially offered these buyouts for their private practices. And I didn't believe it until we also got a letter here at our hospice. And so what happened is they sent us a letter. Basically, it's like this: we want to purchase you. You talk to this person. We go through this little evaluation thing. I'm like, nah, I'm good. I don't want to do that. Within 6 months, we got a letter saying that we didn't do something, so we were kicked out of this specific insurance group. Upon further research, I found that this specific insurance group had actually purchased one of the biggest hospices on this part of the country. So they essentially are going to do the same thing to doctors. It's inevitable, right? So you guys sign it.
Yeah, you're talking about the muscle. I could use another M word. I could use another M word, but not going there. But
what are we supposed to do as patients, though? I get the money, but how are they going to be seen adequately with 15 minutes of your time?
Yeah, I think it's a good question. I think it puts the squeeze on the provider, that being, doctor or advanced practice practitioner, nurse practitioner, or PA, physician assistant, to really maintain quality. Because at the end of the day, I know a lot of people love to blame the doctors and the doctors just pushing the conventional medicine and all that. But let's face it, when people have problems, they're still going to their doctor. Okay.
I was going to say, like, from my perspective as a health and wellness professional, prevention becomes that much more important, right? So if you know that you have family history, or if you are predisposed, like your doctor's giving you that warning on your last appointment, you better do something. Like, you are pre-diabetic, you're on the border for having hypertension. That's your chance to take action. So waiting another 6 months or a year for that next visit and the next lab work to come back, like that is very risky if you're not making significant changes to your health and your lifestyle with nutrition, with exercise, with your day-to-day habits. So become less reliant on the system, essentially, is what I would say from a medical perspective. So start to take control of your health.
Yeah, I think the other thing too, and that's a fantastic point. Really, that is really going to be the paradigm shift going forward, as far as you're talking about the health and wellness of an individual and a community. But I think, with that being said, whatever education that you can get that is good and reliable, and not wait for it to be presented to you, and it may be in a Q&A inside your doctor's office during that precious time, that encounter still being important, but really being able to maybe help dictate the narrative a little bit with your doctor, is to come in learned, come educated, learn what you can about your condition, your illness, your disease. And that can be difficult in itself. But that's really like the effort that what we have been trying to do with our program. I'm going to plug us, Real Deal Health, right? Yeah. We're trying to allow people to say, like, listen, we know you've got an issue here and you want to address it. But if you're not sure where to start, let's start together with the basics. Let's build a foundation so that when you go into that next doctor's appointment and they start telling you about an A1C percentage with regards to your diabetes, you know what that means. Right? You're not saying like, hey, explain that to me. And we're taking up the precious time that we don't have. Yeah. So I think, yes, prevention, 100%. But even before that, where do we start? We start with education. We need to get down on the level of our patients, down to their level, and really bring that information to them in a way that they can understand and process, so that we can raise their health literacy. Health literacy is really the crux of the matter here. I think that's going to make for better, more efficient, more proactivity as far as health and wellness, and really best utilize that time when you do get that time with the doctor.
And I guess my next question, which is probably for a lot of people that we see, if you look at you all as you all have a program that's a supplement, but right now we're in a space, particularly in America, where they're considering making significant cuts to both Medicaid and Medicare. Is there a way for, if someone only has $100 a month, right? Would it still be beneficial for that person to have some type of supplemental care similar to the program that you guys provide? Or are you only suggesting that use us as a supplement to your regular doctor? So
we really strongly believed in the power of, like Dale said, that education and empowerment and really having that hands-on approach. And we know that most programs out there cost hundreds of dollars a month. So yeah, if you don't have that budget, then you kind of feel locked out of that system and you feel like there are no options. So that's why we were priced at $27 a month, because we know that there are so many people who want to do something about their health and want that kind of transformation in the 6 months, in the year lapsing their doctor's appointments. And, Dr. Google is only so helpful, and there's no accuracy on Instagram or any kind of social media these days. These are influencers most of the time who are giving you health advice. So when you have two experts come together offering a program at $27 a month, that is all about creating this health transformation, giving you the tools through, an actual online workout program, how to shop at a grocery store, how to eat out at a party with friends. This is what's meant to take you to a whole other level of health literacy and empower you so that you can make these changes. And the cost shouldn't be a barrier. We strongly agree with you. Like under $100, $27, you're probably spending that a month on coffee.
Or more relevantly, on medications, you're probably spending much more money.
Yes.
Right.
That's a whole nother conversation, because now so in hospice, we pay for medications with people on hospice. We pay for their medication. The costs of medications for us has gone through the roof.
Yeah.
What is that about? Can you explain that? What is this?
How much time you got?
Until for this one, we all need to know. We all need to know.
So there's a bunch of things that are going on. And the most obvious one that a lot of people hear of is that, you know, a lot of these drug companies, the R&D goes down in the United States, and it costs something on average like $1 billion to bring a drug to market. And this money may be invested and spent, you know, largely or solely by that pharmaceutical company. And if it doesn't get through the last phase of like a clinical trial, they eat that cost. So these pharmaceutical companies, we're talking about one flip side of the coin right now, that being, you know, from the perspective of the pharmaceutical company, go through so much financially, and it sometimes can take like a decade to get a new drug out to market as well. So you're talking about massive money, time and energy, private investment. Maybe they're getting some money from the government, but again, a lot of it could just wind up in the trash at the end of the day. So when they do get a successful drug, you know, they justify the large cost up front when that is a new drug out to market, that, you know, they have it tied up legally as something that cannot be made into a generic brand. They charge a lot for it. And this is how they justify the recuperation of the costs and all of startup and investment that was initially put in. And so I guess from a business perspective, that makes sense, right? Like you would want to recuperate the $1 billion you spent to bring this thing to market, right? You deserve some sort of reward or credit. Okay, I get that. But here's the funny thing is that you look at the rest of the world who has access to these medicines, and they're buying them for cents on the dollar compared to the customers and the patients in the United States. So
why is that? Why is that?
What's up with
that?
Why is that?
Because their governments regulate it, and they're involved. And here in this country, we're very, very concerned and cautious about how much the government is involved in things. And then it's funny how other things we kind of let slide and overlook and be like, well, you know, the government's just putting this into action to make things better. So it's funny how perspective can change on certain things depending on where you stand in that whole model. If you're a big private equity guy and you're invested in one of these pharmaceutical companies, you know, at the end of the day, you want full bag for that new drug that just got released, right? So anybody who's holding, for example, anyone who's holding like Eli Lilly stock, and you know they've recently come out with GLPs have been around for a while, but they released some of the more modern ones that are really good, very good selling. I mean, you own that stock, you're going to want to get some return there, right? And they're like the best selling drugs out there right now. They beat all these biological drugs by a mile, like Humira, which has historically been the best selling, most profitable drug in the world for like the last 20 years, even compared to chemo drugs. So there's that. But I think that here, I would say one thing that's positive about this administration is that they are, by the sounds of it, trying to push for transparency on the cost of these things. They are trying to put a cap on the cost of these medicines, because they know that, you know, there should be no good reason as to why we need to gang up on citizens in the United States. If this is a drug that's available globally to like 8 billion people potentially, not saying that 8 billion people necessarily need to be on the same drug, but if you take a fraction of 8 billion, there's enough money to be made there, I'm sure, that they can recuperate their costs. But why is the United States bearing the brunt of that? So that's kind of it's a bit of a riddle, and that's kind of my big question too. And I may not know all the ins and outs of it, but I just think elsewhere in the world, governments, they will either subsidize it or not, or they'll put a cap on the cost of these meds and say, hey, you can sell your drugs here, but like you're not selling them for what you sell them back home for. $700 a month is ridiculous.
Yeah.
People can't.
So I thought when this administration came in, they actually took the cap off of some very important drugs. Is that not right?
No, I don't know about that, but I know that, you know, basically they've been trying to push for transparency as far as costs of certain treatments or medications in the hospital.
They're trying to bring the cost down to metformin specifically. Right. That's a widely used medication.
And that actually is an interesting point. Mm-hmm. That was kind of my second part of this answer to your question, which is, and we've seen this in recent years as well, and this is not the pharmaceutical companies, but these are people who are, how can I say politely, opportunistic. So you've got one example is that guy, Martin Shkreli, who took an old medicine that has been around for decades that costs, nothing, that we would be using for pneumonia prophylaxis in HIV patients. Okay. It was like cents. Well, he cornered the market on that through private equity and said, okay, I own all the production. This drug now costs 1,000 times more a month. And people are like, this is extortion. And even he got pulled into court and they're like, yeah, this is monopoly extortion. This is wrong.
Right.
Yeah.
And same thing with EpiPen.
EpiPen as well. Somebody figured they'd be smart enough and corner the market and made EpiPens like $600 a pop. Yeah. Like, how do you say to a parent with a child who is anaphylactic to, chocolate or peanuts that they need to be carrying this on them? But like, I can't, I don't have enough money in my HSA account to buy this, or
and
my insurance.
Yeah. And they expire. You got to get new ones.
What is the happy medium between business and healthcare, in your opinion?
With all that being said, okay, interesting to note. And again, these are not my opinions. These are facts. And I don't claim to know about all of it. Like, why is it that those meds are cheaper out there? I can only assume that the governments there are a little bit more conscientious about cost-wise for the end consumer. So they either put a cap on the medicine, or it's heavily subsidized, maybe in those first initial years until a generic form is available and acceptable for use. So with that being said, I understand that my patients need certain medications, and sometimes they can't get access to those medications because they may be completely out of pocket on the cost of that. And for some people, saying $25 a month for this medicine, that it's that, or like I have to miss a few days of eating. And you say, well, we can't have that.
That's a real thing.
So here's what's really cool. There are a number of medications that I use very commonly for a number of conditions that are like on the $4 Walmart list of medications at the pharmacy. So if you have to go and pay out of pocket for, let's say, medications like lisinopril, okay, which is a common blood pressure medication, and we use it for a slew of conditions, not just for blood pressure, heart failure, we use it for kidney disease. It's a great drug, but it's like $4 for a month's worth of it, okay? Cholesterol medication, $4 a month. Metformin is like $4 a month. So I think companies have tried to put some goodwill out there by taking some type of, social responsibility with doing that, because their access to buy these medications is probably like cents, So it's like, how much money do you have to turn around and gouge people for to actually turn a profit? I mean, it was Walmart's everywhere. So, if you get millions of people buying meds through there, it's still profitable for them, but they're not gouging anybody. So all of a sudden, you've been able to fulfill a list of medications that an individual may need to take, and maybe they get all their meds total for like,
dollars, yeah,
$8, $24 for the month, as opposed to maybe one medicine that would cost them $25 a month.
So is that without insurance? Because there's different prices, right? When you go to the pharmacy, if you don't have insurance, a lot of times your cost for medication would be significantly cheaper than if you actually tell them you have insurance.
Correct.
So yeah, like cash pay is almost like a way to like bypass the brain surgery when it comes to reimbursement. We'll talk about it more in the sense of providers. So for me, like, I work at a couple hospitals where, you need to do billing and coding, and there needs to be a note, and that information goes off to the patient's payer, that being who their insurance carrier is, and they'll review all this, and then they will, basically agree or disagree on reimbursement for those diagnoses, for that hospitalization, et cetera. And that sometimes can take like up to 90 days for a provider to collect that money. Okay. And it's not like you're saying, well, I'm going to run the clock on this and collect some interest on that. They're like, no, you'll get paid when we decide you get paid, and how you get paid, and all that good stuff. So for a lot of docs who maybe do procedures or even for like, concierge, they'll just say, listen, this is what I'm going to charge you, as opposed to you having to pay a copay that might just be a little bit less than that. And you don't need to bill your insurance, and we'll do it. And that's it. Or even sometimes people's copay are more than what the cash charge is.
Exactly.
Because the provider's getting money in hand for that. And we say, thank you very much. And that's it. Right?
Wait a minute. So I only know this because we actually pay for medications, right? And so we've noticed that, well, not just we've noticed, families have noticed that even the prices that we pay are cheaper than the co-pays than some of the families were paying originally. And you're saying that if they just don't tell them they have insurance at all, they can just bypass it and pay cash.
Yeah. I've seen that recently on like one of these doctor Facebook groups that I'm on, where this family said, you know what, we just decided we're going to tell them we're paying cash at the doctor's office. And they actually, if you are not paying by credit card, if you actually pay by cash, you're avoiding using their billing system. And it was a true story. They were given a different price because they were paying cash, even versus paying credit card. And I was going to tell the story about, I have a nose spray that's $300 prescription for a nose spray. And my insurance won't cover it, but I can pay $40 for it if I pay out of pocket cash. My price is $40.
What does it do?
It's for my allergies.
Oh, okay.
I've tried everything else. There's also have you heard of Good RX?
I have.
Yeah. So like you can look on there and price compare your prescription across all of the pharmacies.
But you handle the business side of you all's healthcare business. And I guess how do you all find the balance between running a healthcare business and still wanting to remain profitable, only charging $27 a month?
Do you want to wait for Dale to come back?
Sure.
Okay.
That's it for interruptions.
Okay, we're all done.
Yeah. Oh, the last thing we were talking about.
Okay, so we were talking about the medication. Let's go back to the medication thing. So, I actually have a nose spray that helps me with my allergies. That is $300 when billed to my insurance company, but my insurance company won't pay for that. And so I went on an app called Good RX, and I even asked my pharmacy, well, I'm going to pay cash for it. And the cost to me was $40.
What's the name of the medication?
Ryaltris.
Azelastine?
No, that's the other one. This one's Ryaltris. Yeah. Ryaltris.
And so what's the reason that they wouldn't pay for it?
No, they won't cover it. I mean, it's just my plan with my deductible. I mean, just I haven't met my deductible. They won't cover that kind of cost. So, yeah.
So I was always told that you could only get the cash price if you didn't have insurance. You're saying even if you have insurance, you think for you anyway, you still were able to get the cash price.
Well, at Walgreens, absolutely. You tell them, no, I'm not going through my insurance. And then same thing, like I was saying, I'm on a Facebook group with, it's all doctors' wives. And in this Facebook group, one of the physicians' wives said she has foregone their insurance, and because they don't have any serious concerns with their children and their family. And she says when she goes to doctor's appointment that she's paying cash. And when she offers to pay cash, she gets a completely different rate, even than if she were to pay by a credit card out of pocket, because they're not going through their billing services. And she walks in with cash on hand and she pays a significantly less price for their well check or sick visit.
So it's kind of like this, like it's fine. You know what insurance is? Insurance, one of those things that, you want to have it, but not use it.
Right.
And not the other way around, that you don't have it, but you need it.
Right.
I'll give you an example. And again, everyone's different. Everyone has different needs. Okay. And I would say, thankfully, our household everyone is healthy and well.
Sure. Of course.
For what we know for today. Okay. We're grateful for that.
Sure.
I just recently signed on with a different group, and I'm now with a different insurance carrier for our healthcare, for our household healthcare.
Okay.
And I basically, what I did was, knowing that, we're mostly just going for wellness checks and the odd time we need to take our kids to the pediatrician because maybe they have an earache or a fever, and that's rare at best. Thankfully, they're healthy. What I did was we bought the cheapest plan that basically has a high deductible. And the way that works is that, yes, we're going to pay out of pocket for maybe some day-to-day stuff. But what I did was I maxed out our health spending account. And those are pre-tax dollars that I can set aside in addition to my cheap plan, which is still not cheap. It's like $16,000 a year for the household, right? But four people. But now
that's actually really good.
Okay, yeah, and I mean it went up to $25,000 for the year, you know. But what I've been able to do is with that complementary to that, I've been able to max out an HSA account, a health spending account, which are pre-tax dollars, right? Similar to the money that goes to pay for the policy. And that money can be used for copay or to buy sunscreen or to go for medications. So that money can be used, right, for those costs that do come up because of maybe a higher copay that you may have because you're going with a cheaper plan. So
they're not dangerous though, right? Like, and when I say dangerous, because when I think of insurance, I think of catastrophic things. I think of cancer. Right? Is it not dangerous as a doctor to you?
So the insurance, so some insurance will say that maybe for the cheaper plan you're going to be covered 80 to 90%, and if it's a major catastrophe or hospitalization, even with the cheapest plan, like you're going to be very minimal out of pocket because let's say they say you're on the hook for the first 12,000. I mean, if you're going to the hospital for something serious, you're going to blow through that $12,000. You're going to blow through it in 24 hours or less. I mean, before you make it out of the emergency department, you've blown the 12 grand. At which point, you're on the insurance plan for the rest of it. And again, for mostly all of that, unless they can figure out a way that they're not. But I mean, it's clearly in writing. Now you can buy a more expensive plan and have a cheaper copay, but is that worth it at the end of the day to save a few dollars to spend a few thousand more if you are under the impression that you're generally dealing with healthy and well individuals in your household? I mean, it's a good question. Maybe some people might feel like they're playing with fire a little bit. But again, I think we've done pretty well using that HSA or to pay cash out of pocket.
But I think this is where, right, that works for your household.
Exactly.
That's probably, at minimum top 5%. The average person, let's just say 95% or less, they can't do that. So what is it that you suggest that they do? Because if they do get that cheaper plan, and maybe you guys someone can pay out of cash for their visits, but if that visit is still $75, right, they still, from what I've seen, they still wouldn't be able to do that. So what do they do?
That's why the system's broken.
And there's your answer.
Coming from Canada. So here's the thing. We're both Canadian. We grew up in that system. Our friends are still in that system. Our family's still in that system. Everyone's taken care of. It's shocking when I tell my American friends and colleagues that you never get a bill. The one time you get a bill is if you take an ambulance ride, and that's a standard fee of $100.
No way. You can't even get a non-emergency trip in America. If you want a private room at a hospital, and you have some kind of health insurance that's through your employer, which some people do have, then you'll potentially be entitled for a private room upgrade, have some medications covered, maybe some physiotherapy covered and whatnot, but you don't need insurance.
Now,
Can we do that here?
Okay. Keep in mind something, okay? In Canada, if you're in the top tax bracket, the government is taking over 50% of your take home. That's your income tax.
So you don't get to choose your plan. Like that's what we get to choose our healthcare plan here, your insurance plan. You don't get to choose that plan.
And that's what
it's free though. I'd rather not choose it if I don't have any healthcare bills.
Now, and the way it works is that, we have a how can I say, a particularly discerning population largely, and we'll say, the middle and upper class households in the United States. And I see it personally when people come to the hospital, the way that I encounter them, the way that, they tell me sometimes how they want things, or they don't want to go to here, or they want to see this person, and all that. And that requires some sort of strategy, and that requires having some type of insurance in place that allows you to call your own shots. The way that healthcare works in a universal system is that just because your golf game's a little off because you got a bum hip and you need to have your hip replaced, you may not have infectious arthritis, because that infectious arthritis patient who's got an infected hip or has a recent fracture, that guy is taking priority over you. So you get pushed into the waiting list.
Yeah.
If you're here in the United States and you have a good insurance plan and you want that new hip, you're getting that new hip because somebody will do it for you. So it's very much in the unfair sense of it all, it's a pay-to-play situation. If you can afford it, you want it, you get it. Back home, that's not how it goes. They are trying to develop a two-tier system a little bit to free up the congestion. And it's the same providers, the same doctors, same system and all that. But that's largely how the universal healthcare system works.
We did record a really comprehensive and informative podcast on that with one of Dale's former colleagues who was practicing in the US with Dale and then went back to Canada to practice internal medicine there. So we really dive into the details and the nitty gritty on that. There are so many different ways the systems are different and work and don't work.
But I guess for me, it's just on a basic level. Do the doctors get paid the same? Do the nurses get paid the same? Like, are the medications the same cost, right? Like, that would be like the starting point for me. Is it the same cost to go to medical school there, right? Do you incur the same amount of debt to get to where you are? Is that the starting point? Like, how can we even get remotely? It sounds just from this conversation, it sounds like to me, right? I would rather be in line because I have a bum hip versus someone who actually has something that's life-threatening. And what you're saying is, in America, if you have better insurance, your bum hip could actually be taken care of first versus someone who has something that's actually life-threatening. So
I think what it comes down to is not necessarily that if you have a better policy or more money that you're going to jump the line, but you won't be seen as a lesser priority because there'll be another provider. We have 10 times more doctors here, or maybe even more than in Canada, because there's a bit of an artificial scarcity on doctors back home, and that's a whole other conversation. But here's a lot of doctors. So, there's a private guy who's doing hips who you can go see with your awesome insurance plan, or, pay a large fee out of pocket. You're going, right? But that's not going to screw up the person who needs to have something emergently done for that hip. I mean, that patient will still be brought to the hospital immediately and still be seen and get their surgery done. So it's just a lot of it comes down to like resources and availability. So back home, it's a universal system. It's available to everybody. Everybody will be seen. No one's left behind. But there's real triage involved. Hey. If you're still walking around and you're just complaining about your golf game, sorry, man, you're going to wait a bit. But you've got like an infected hip, you're coming right now. So there's a real work done as far as triaging and prioritizing patients based on how many doctors they have.
The government's paying for it, right? So they get to dictate that. And they get to dictate how many doctors, to answer your question, they get to dictate how many doctors are graduating medical school or being accepted into medical school because they are subsidizing the cost of medical school.
Yeah, it's all based on a budget.
You don't even pay for medical school.
It's subsidized.
They pay a portion of it.
They pay a portion of it.
How much do doctors make there versus here?
They maybe make more, but here's the thing: is that you invoice directly to the government who's paying you. Right. So let's say a doctor back home let's say a doctor like me back home makes $500,000-$600,000 and Canadian. You're now in the top tax bracket. So the government says, here's your money. Oh, and by the way, we're taking back half of it.
That's how it is in America, though, isn't it? I feel like I pay.
It is, but our taxes are less. So people and our cost of living is cheaper.
And doctors, especially if you're in private practice, can dictate what your rate is to the insurance companies and say, well, I actually command this much money for this type of service, where in Canada, that's all regulated.
So there's no standard pay for doctors' offices. So you're saying, hey, this is how much I charge for this. You and the insurance company can decide to pay it.
Recommend it.
There are some parameters here that doctors need to fall, within, and you can't be completely unreasonable because they just won't pay it. Right. But back home, yeah, it's very standardized as far as a doctor practicing here or there.
Which is better? If you had to pick one, which is better?
Which is better? I think it all depends what your priority is, what's your situation, and that's really it. What's your priority and what's your situation? I mean,
I think for us, coming from, I will speak as I think we are privileged. We can, like you said, we can afford that copay of $75. Mm-hmm. So for us, we're going to say, well, it's like kind of a give or take, blah, blah, blah. It doesn't really matter. But for somebody, sorry, this was silent. But for somebody who was not, who, cannot, they are on the lower economic income level. There is a lot of concern about how they're going to pay for their health, whether or not they should go to the doctor. People second guess whether or not they should go for regular routine checkups.
Our friends who are our friends, some of them who do very well for themselves and are very well established, they don't even have primary care doctors, they're kind of very hesitant to go see a doctor regularly. Yeah. And these are people who are middle-aged. Like, you should be established with a primary care provider. So the irony there is even interesting, being here in this country. And then back home, people are inclined to be established with a primary care doctor, but the wait time is so long, or they can't get in to see one, or they don't even want to see them in an office. They want to have a remote encounter with them. So, it's one of those things where you say, well, which system's better? Which one would you prefer to be in? I think both have their strengths and both have their weaknesses.
Yes.
So I guess I'm just now move on from the Canadian thing in a second, but what about like the medications? Are the medications the same in Canada? How does that work?
Medications are the same, but cost-wise, again, a lot of this is heavily subsidized. So you're not going to be concerned about going bankrupt trying to buy chemotherapy. If something comes up in your world as far as malignancy is concerned.
Oh no, you're not paying for chemotherapy in Canada.
No. Whereas here, it could bankrupt you if you don't have some basic insurance in place, and you're going to be paying out of pocket costs, or like the copays could be exorbitant. So there's that. The bottom line is, at the end of the day, there's a safety net. The safety net in Canada is going to make sure that you're not taking on a second mortgage to stay alive necessarily.
Which I've seen. I have literally seen people borrow against their homes to pay for procedures.
That's right. And that happens, and it's definitely unfortunate. But I also question too, and I plead ignorance here, and everybody's situation is different. Is did they even bother to put in some proper insurance in place to begin with? Why was there a hesitation for that? But when push came to shove, all of a sudden they're leveraging themselves now in this desperation to stay alive, and they should have had the basic. You know what I mean? It's kind of one of those things, going back to what I said, where it's better to have it and not need it than the other way around.
So I could tell you this one that I'm thinking about. The wife, she ended up getting cancer, and for whatever reason, they were trying to get, the chemo wasn't working, traditional chemotherapy. Mm-hmm. They needed to do some type of medication that wasn't FDA approved. And the only way, and it actually worked. And the only way for them to do it was essentially had to pay out of pocket for it. And so they ended up having to get a home equity line of credit or such to pay for it. And it actually ended up saving her life, where the chemo was actually seeming to almost, in a sense, kill her. So that was their situation.
A very unique situation for sure. And I'll tell you, I've seen some really great oncologists do things like fill out, a ton of paperwork with a drug rep, and a drug rep, I know that, again, pharmaceutical companies get a bad rap, but the drug reps would be like, hey, let's make this happen. Fill out the paperwork. Let's get this as an off-label use per se. And at least at least we're doing it. Even some people can get this medication at times for free because it's, I wouldn't say experimental, but it's new and maybe it's just passed through a phase of testing where we know at least it's non-inferior from a safety standpoint for humans to take. So there are ways too where they can make it more feasible. But that is a unique situation, and I mean, at least at the end of the day, patient got better, which is good. But now you say it's like, what's the cost to stay alive? I would say priceless. It's, I've seen doctors even say too, like, talk with each other, oncologists be like, would you push that $300,000 drug for this patient with the stage 3 breast cancer? They'd be like, yeah, who cares? Who cares what it costs? Like, if the insurance companies are able to pick up the most of it, I'm going to prescribe what I feel is like best for the patient. And while it's like, it's well intended, and I see it that way, but then you really bring up this whole, the balance, the reality at the end of the day as like, okay, so how does that look financially for the person who will need this medication, even though you think it's the best and it's the most expensive and it's going to do what they want? You really have to think about those things in the balance. Like, what is it going to take? We know what it's going to cost, but what's it going to take? And I think we've lost perspective maybe on, we know the cost of everything and the value of nothing. When it comes to medicine, or maybe these are even things that, like, as doctors, we shouldn't really have to think about, but we do so often. This is just a more complex example of what I discussed earlier. I know what my patients need. I have a heart failure patient. I'd love to put him on, this medication, but I understand that, they can't afford it. So we'll do this and that. Hey, still good drugs. They work, but they're on the $4 Walmart list. So I think that's where the art of medicine comes in, is being able to work with patients in their specific social economic situations to do the best that we can to give them a sense of value, right? And not just put a hard cost on, like, hey, this is what it costs. Yeah, exactly.
Right.
There is some gray area that we try to work with. That is the art of medicine.
I would say this is why we need more doctors like you, because, of course, but it's because everyone now is so afraid to say anything for whatever reason. And what people don't realize is, if we don't have advocates like you all, the only person who really suffers is the patient. But it's not the well-off patient. They'll be fine. It is the people on Medicaid who have it or might end up losing it, or your people who are, even in America, we just beat up on the middle class. It's one of the things that, if there's one thing about America I would change, we really beat them up. It really grinds my gears. But you being a patient advocate is why, and even I was telling your wife, even at $27, like, I don't know if people really understand. You can make more than $27 doing a lot of stuff, right? This, to me, almost does feel like a giving back project, right? It almost feels like this is you all's way of saying, I've got something for you. I will help you. I'm not your number one, right? I am a supplement. But where we're headed, I don't think Medicaid will be taken away. But if it does, this might be a reasonable choice for a lot of people, instead of them having to just go on ChatGPT and kind of, because they don't even know what to prompt, right? They just put anything in there.
That's right. That's what it is. And you need to feel like you're not alone in that. And there are a lot of people who are in the similar situation. They are trying to work towards better health and towards maybe reversing their heart disease or diabetes, and being a part of like a general community helps give you a level of accountability, help gives you more encouragement to keep going, because there will be rough days. There will be, times where you feel defeated, or, your energy is just like in the tank and you don't feel like moving that day. So having that surrounding to help lift you up and keep you going, keep you motivated for the right reasons, because you want to be able to, get off the toilet when you're 80, 90 years old. You want to keep driving your car. You want to be there for your grandchildren. The way you said your grandparents were there for you. That's meaningful. That's quality of life. So you have to start sooner than later and make that investment. And this was born, like you said, of a project. It was a project of love when we were living in Detroit. We were living in Detroit, and Dale we were around a community of people who, 50, 60% of the population were diabetic or pre-diabetic. And
face certain, adversity as far as being able to afford healthcare, afford medicine.
Yeah,
these were their real issues. You know, and it's not that they didn't want to get better. It's just it's tough when you don't know where to turn to, like, how to get the help and where to get the help. Again, going back to the who, what, when, where, why, how. Right. So, if we could find a way, which I think we did, in order to connect with people so that we can share
our expertise,
what we know, with you, and go slow and really build the foundation. That's the way to build a house. You got to start with some footing.
I absolutely love it. And I just want to make sure that we've talked about all of this, but in this particular segment, we didn't tell them where to go. Where do they go to actually sign up? Like, how do they do that?
You can find us on Instagram. It's at real_deal_doc.
Yeah.
That's our Instagram page. And we have all our links there to join our Real Deal Health community. You can also check out our website, www.realdealdoc.com. And we have all the links there. Subscribe to our newsletter, because we send out free tips through our newsletter that we send out weekly. And you can be a part of that. Yeah. Mm-hmm. And then even on our podcast as well, Real Deal Doc, we give a lot of information out there, but we love welcoming people into our community who are ready to make that change, want to be empowered. They want a transformation. They see maybe their parents or their friends following a certain pattern, and it's tumultuous. You can like blink and all of a sudden you're there. You're that person. After you've warned your parents, so many people, nag their parents. You need to take better care of your health. You need to, walk more. And then, oh my God, I'm doing the same thing.
How things look like when you're 60, 70 years old is based on what you're doing now in your 30s and 40s, right?
Exactly.
I appreciate it.
So you can take the pill, or you can take maybe our pill, which may be a harder pill to swallow, but it may be the one that you prefer, because at the end of the day, it's going to give you kind of that durability that you need when it comes to really maintaining and sustaining health and wellness, right?
And avoiding dealing with insurance and dealing with this tumultuous system.
An ounce of prevention. So
yeah.
I appreciate it. Well, I want to thank you guys for coming. And then for those who don't know, we had to double back on these guys because it was just such a phenomenal interview. And we ended up talking after the last interview. And I wanted to bring them back so we can get the business of healthcare kind of get put and broken down for people who don't understand. Not we're talking at you, but talking to you, helping you get your mind around it. Is there any last thing you'd like to leave them with today?
Choose your heart. I think we said it before. We'll say it again, right? You can take the pill, but that pill in the long run, it may be, again, the hard pill to swallow. If you want to take the high ground, get educated, learn more about what it is that you need to do to really durably sustain your health and wellness and live your best life, then, get with us. We just want to share what we know with you in a way that you can understand. I mean, this is the way. This is definitely the better way.
Choose your heart. Well, I appreciate it. Thank you again. And you all know how to reach them now. And any other questions, you know how to go out, go after them, send them a DM, sign up for their program.
Yes.
And I think that they are loving, giving, and want to do for the community. And for me, that's all I needed to know. So again, we're saying if you want them, try them out and go for it. And I thank you guys again for showing up.
Thank you.
Thank you.